Hit Kickin' Country, Z94, Wild Bill in the midday. A very special friend on the phone here is Pattie Curran. And Pattie, thank you so much for stopping by.
Well, thanks for having me.
Pattie, I saw a video of yours that you posted on YouTube that was quite compelling. I said to myself, I've got to get this lady on my radio show for sure.
Well, thanks so much. I've been getting a great response from the video. I was kind of surprised because a friend told me one day, Pattie, you need to make a video. And I told my son to grab my iTouch, and I did it. It's not professional, as you can tell.
I thought it was great, though, and I think it's definitely compelling. Let's start out by telling us a little bit about your son, his health, and his chronic illnesses that he has right now to give us an idea of where your family is at.
Well, actually, I have two children with Shwachman-Diaomnd syndrome and secondary mitochondrial disease. My youngest happens to be more affected. So we do have a lot of medical bills, and between the two of them, they've been under anesthesia over 60 times. That's what I like to tell people, to kind of give them an idea of what our life is, what our life is about. I mean, that's a lot of hospital stays.
The main thrust of what your video talked about was how much you're paying for medical expenses. Let's go back to 2005 and what you were paying then to what you're paying now.
Wow, I mean, it's absolutely amazing. Back in 2005, we had several copays that were, like I said, manageable. The one I like to use is the $131 copay that skyrocketed to $532, after Obamacare. And it's amazing to me because liberals keep saying I'm lying, even though I have the invoices on my blog for the world to see. But from 2005 to 2010, we only had a $50 increase in our deductible. Since then, it's increased $1,200, and they keep telling me, oh, it's not Obamacare. It's the corporate greed. And I'm saying to myself, where was the corporate greed for 5 years when it only increased $10 a year, or even our out-of-pocket max? From 2005 to 2010, it increased $500, $100 a year, and now it's increased $3,000 or $1,000 a year since Obamacare passed. So to me, that's incredible. It hurts families with sick kids like mine because we reach our out-of-pocket max every single year, and we have for 17 years. It
sounds like you guys are going into debt trying to keep your kids healthy.
Oh, absolutely, absolutely. I mean, and we were... my husband was just saying yesterday how this is an incredible year. You just can't even imagine that it would be this bad. We tried in 2010. I confronted Kay Hagan in 2010. I don't know if you've ever searched. If you search my name and her, you'll see videos. And I was interviewed on Fox by Fox and Friends and Neil Cavuto because we told people that this was going to happen. We told people that costs were going to increase, that once you had a government that told you what is and is not covered, costs are just going to increase. Government intervention never decreases costs for anyone. But, they didn't want to listen, and here we are, and we can't even get Kay Hagan to respond. A group of friends and I went up to D.C. back in March and went to her office, visited with her, their legislative assistants that work on health care, and we've still never received a response from Kay Hagan.
She sounds like she's in hiding with a lot of representatives on the Republican and on the Democrat side when it comes to confronting Obamacare and what it means to normal people. So
they don't want to hear it. Her staffers rolled their eyes at us. It blows my mind because they see the numbers. I had charts, Excel sheets with our copays, how much they'd increased. I had the actual invoices. I had Excel spreadsheets of insurance costs and how much they had increased. Our premiums since Obamacare passed have increased $1,528 and some change. And I'm asking the president, where's our $2,500 savings? It keeps going up. And now and again, like I said, I tell people there were increases from 2005 to 2010, but nothing like what we are experiencing now.
And one of the things that you've mentioned in your video is with the health of your sons, you guys really feel the pinch with the medical device tax because that's affecting your son's health care, too, because there's a lot of devices that he needs.
Oh, absolutely. That's the. I don't know if you've looked at the comments on the video that I made, but trying to get people to understand, while our co-pays necessarily have not increased on the catheters, I look at the EOB, estimation of benefits, or I think that's what it's called. Anyway, I look at those. Our insurance company is now paying more money for these catheters because the home health company has now had to pay more from the manufacturer, who has had to pay an extra tax. And so that tax gets passed on to our insurance company. Well, we're not seeing the increase per se in our co-pays, but we are seeing it in our premiums. You're seeing it in other, for instance, the medication my son takes. If you have to give other people free medication, even if it's the $9 birth control, I use this with my kids a lot. I tell them, it's not free. The insurance company has to pay, $9 a month for those medications if they get the generic, which we know they don't all do. But 1 million women getting $9 birth control at no cost to them costs the insurance company $9 million a month, $108 million a year. Well, where do they get that money? Just like with the medical device tax. When that tax is passed on to them, they have to pay more. So where do they get the money? Well, they increase the rates. They increase the cost of medications, like the medication protecting my son's kidneys, that the government hasn't said has to be free.
Yep. And one of the things that parents with chronically ill kids really rely on are those flex dollars, and that is not working out for you either.
No, absolutely not. We needed an increase. I mean, when you have, we're at $20,000 in out-of-pocket. I haven't added it up, but I think we're at like $20,200, somewhere in that ballpark. We used $2,500 in the first 19 days of the year, and had we not had, let me back up. So if we had not had the increases in our out-of-pocket max and our deductibles, we might actually be sort of okay. You know what I mean? But it's really a process that pulls together everything. It's the cost increases plus this. We were already struggling, but $5,000 was much better than $2,500 because you had about, I guess it was like an $800 perhaps savings, tax savings. So that $800 could purchase other medical items, that tax savings that you received for putting it in. But we've really been hit hard by that one.
You guys are dealing with the cost of health care with your own pocketbook, and now there's even another factor on top of that where hospitals are laying off people left and right. Your hospital, where you take your kids, they're laying off people left and right. What's the quality of care like when that happens?
We have seen a decrease in the quality of care. Not necessarily that the doctors are worse, but we've seen the callback times, the appointment times. For instance, my son had his toe has been numb for months. We finally just went to Atlanta, Georgia, to see a specialist there and paid out of pocket because the neurologist who knows something about mito here in our own town couldn't see us until January 29th.
That's crazy. That's like a year. That's next year.
Well, you feel like that, and it's there's just little things that you notice. For instance, I talk about on my video. I talk about the doctor who was never political, would never say anything, and he's now telling us the worst it's ever been. He's miserable. I mean, and it's collapsing. I mean, do we really want doctors who are miserable treating us, trying to make us healthy? I mean, does that help us? I mean, I personally, it's like I like to tell people, they get upset when, neurosurgeons make so much money. And when my son had his neurosurgery, I would tell people, I want that man to be very happy with his life. Because when he opens up my son's spine or someone else's brain, you want him to be happy, do you not?
Your website, your blogs that you have put together, and also YouTube videos, are you getting a lot of response from that? And what kind of response are you getting from social media?
Oh, I have lots and lots of support, and then you have, of course, the attacks from the left. But I think the funny part is that the left has no substance to their attacks. They can only post things like, liar, she's not telling the truth. they have no facts. Or my favorite is, Obamacare hasn't even been implemented yet. And so I respond to them, I said, can you not Google Obamacare timeline? I mean, I think that's so funny. They don't even know that it's already been implemented and that it started in 2010.
And it's interesting, some of the different arguments that I have heard before, where they said, you know, when you list all these problems right now because of what Obamacare is doing, and they'll say, well, it's always been like that. There's problems right now. And I think you're the perfect example. That's not the case. In 2005, you didn't have these kinds of price increases. You didn't have massive hospital layoffs. You're seeing that right now. There is a definite difference between the two. Another argument I hear a lot is, well, you're from a red state, and the red state is trying to do whatever it can to hurt Obamacare. And it's you red staters are doing it to yourself, you know. The arguments are just so weak.
Well, here in North Carolina, Bev Perdue took the Obamacare money, and our Republicans just voted a few months ago to send it back. So our problem is not because we were a red state, because we were a blue state until a few months ago, until January 19th or 20th, whenever Pat McCrory was inaugurated. So that's the other one I like to remind people, that we were not a red state until January. And it really is. It's funny. Our local hospital has laid off 950 people. That's Wake Forest. And they just announced this week that they posted this week that they have a $51.1 million loss because of having to implement the electronic record system required by Obamacare. You can search that and find that. But and so they're freezing raises. Oh, that's great. So the people who are now taking care of my children are going to be unhappy because they're going to be more worried about not being able to pay their electric bill or their car payment or any number of bills, because they're not going to be able to make ends meet. I mean, because if you don't get a raise, that doesn't even adjust for the cost of living. So you're going to be a little more stressed out.
Wow, this is just so much information at once, and it takes a lot to digest this. And it seems like that it's a little bit hopeless. Do you have a little bit of hope? Are you hoping that things will turn around? And what can people do right now?
Well, they can join on to the Defund Obamacare movement. Don'tfundit.com or don'tfundobamacare.com. I'm taking it head on. We're going to D.C. in 10 days, and it's the Homeschool Moms Against Obamacare Defund Obamacare tour. We are going to be meeting with our representatives in Congress, and we are going to be walking to every congressman and every senator's office, handing them letters and speaking to them. We did this back in March, and we're going to be doing it again here in September. I feel like we, the people, have to tell them what we want, and I'm going to be in their faces. Because at the end of the day, I have nothing to lose. Because if we do not repeal this abomination of a law, if we don't repeal it, my family's destroyed. We already know that we're in financial ruin. I mean, we're very close. I mean, we're making ends meet, but, I mean, we don't have $17 trillion in debt that we can build up. You know, we're not the United States government. So if we don't fight this and we don't return America back to its founding, my family doesn't have the hope of rebuilding. And I really feel that way. I know a lot of people think, oh, that's gloom and doom, and you're over, you're exaggerating. But it's the truth. Obamacare will be the death of this nation because every family will feel what we're feeling. I mean, you may be healthy now, but the first illness is going to wipe you out.
Wow, it's breathtaking. We appreciate you stopping by. That is Pattie Curran. Pattie, we're going to put all of your links to your blog and also to your YouTube video on our website, WBYZ94.com. They can just click on the Wild Bill tab, and everybody can check it out from there.